Did you know every time you move and breathe, you are helping lymph flow somewhere in your body? Exercise can be used strategically to help lymph flow in swollen areas. If you have lymphedema, you've probably been told that exercise should be part of your self-care routine. But how many of you have wondered if what you're doing is actually working? In this video, I'll walk you through 4 ways to check if your exercise plan is working, when to reassess it, and what to do if something doesn't feel right. And if you stay until the end, I'll tell you how to get the free, super easy printable checklist I created to help you track your progress. The lymphatic system has a slower pump that moves lymph through the vessels, not a big muscle like your heart that pumps your blood. The lymphatic system does get a good boost, however, when nearby muscles are contracting or when nearby arteries are pulsing with each heartbeat. And every time you take a nice deep breath in and out, the lymphatic system gets a bit of a boost as well. Before we look at how to assess your exercise routine, let's take a look at the 4 types of exercise that you can incorporate into your life that have specific effects on lymph flow. Cardio exercises help the heart and lungs and can take many different forms. But for the lymph system, when the heart beats faster, your lymph flow increases. Whether you use your own body weight, lift weights, or use resistance bands, every muscle contraction and joint pump improves lymphatic flow. Tight tissues such as fascia or muscle can restrict lymph flow. Loosening these through gentle stretching allows for easier movement of fluid through the lymph vessels. And restorative deep breathing exercises creates alternating pressures in the chest and abdomen, which aids the deeper lymph vessels called the central lymphatics. What does it actually mean for an exercise plan to be working? Results from exercise do not always occur immediately, nor do they reduce all of your swelling. In fact, exercise is just one aspect of chronic swelling maintenance. It is used in combination with your compression garment, skincare, and self-manual lymphatic drainage to prevent lymphedema progression. Some signs that your plan is working include better limb mobility, stable or reduced swelling, lighter feeling limbs, and no increase in symptoms of discomfort, limb heaviness, or tissue changes. Exercise supports lymph flow in multiple ways, but since swelling is complex, tracking your response helps tailor what works for your body. And since your compression garment loses its effectiveness over time, garment manufacturers recommend replacing your compression garment every 4 to 6 months. This is a great time to reassess your self-care plan, including your exercise plan. Other times you may want to reassess your exercise plan are with flare-ups of swelling, when your measurements have plateaued and you want to try something different that can target your swollen area more effectively, after an illness, and lastly, if you have had any weight changes. Measurements of your limb can be done to track increases or decreases in size. Doing them before you get a new compression garment can help you tell if you need to reduce your limb size with intensive compression. By looking at and feeling your swollen limb, you can notice any changes such as dryness, thickness of the underlying tissue, or any sensation or color changes. Self-assessing your limb range of motion lets you discover if there are any difficulties in the way your swollen limb is moving. And lastly, quality of life counts. Ask yourself, how often do I exercise? Could I do more, or is it getting in the way of other things? Do I like what I'm doing, or does it feel like a chore? Or do the exercise I am doing make me feel good? If you're finding this video helpful, please subscribe, like, and share so others can see it. If your swelling assessment shows increased swelling, skin and underlying tissue changes, more difficult movement, or that you are just unhappy with your routine, you may want to readjust your plan. Adjusting your plan may mean more than just changing your exercise routine, because your lymphedema self-care plan also includes the measures you take for skincare, self-lymph drainage massage, and your compression garment. These all go hand in hand to manage lymphedema. If your assessment shows any of these signs, your doctor, lymphedema therapist, and exercise specialist can help. Thank you so much for watching. Remember, movement doesn't have to be intense to be effective when it comes to managing your swelling. What matters most is how your body responds and how you feel. And that's why reassessment of your exercise plan is so very important. Download the free checklist I made just for you. The link is in the description box below. And don't forget to watch my other video on the 7 ways exercise helps swelling. See you in the next video.